this course. Before we actually talk about the literature review, though, I'm going to talk a little bit about how experimental drugs are tested in humans. Sometimes when you will read the title of a study, you'll see things like phase 2 trial, phase 3 trial. In particular, when you're looking at contrast agents or specific types of interventions. So I wanted to give you a little bit of an idea of what that means. The FDA governs research that involves human subjects, and in particular, drug and device research. There are 3 steps in drug testing, and contrast agents for CT and MRI and ultrasound fall under the category of drugs because they're medications. These steps are called phases. So initially, the FDA will grant what's called a new drug approval, and then these phases will commence. A phase 1 study looks at the safety of the drug, and this is done in a small number of patients. First, there are animal studies that are done, and then there are studies in humans. These are somewhat arduous studies for patients to participate in. We only did one phase 1 study, and in that phase 1 study, the patients had to check into the hospital, and they were hospitalized for a weekend. They were injected with a CT contrast agent, and then they had blood draws and urinalyses and sputum evaluations very frequently. They were compensated for their time. But the goal of a phase 1 study is to determine how that drug affects the body. How is it absorbed? How is it metabolized? How is it excreted in the body in the form of urine and blood in particular? The phase 1 study will look for side effects, and the doses that are given in a phase 1 study end up being higher than the doses that are given once that drug is put into clinical practice. About 70% of experimental drugs will pass phase 1, meaning that they're safe, and then they go on to phase 2. A phase 2 study is concerned with efficacy, and efficacy means, is that drug able to produce the intended result? So that means for us, if we're looking at contrast agents, will that drug give us the appearance or the effect on our images that we are hoping for? This phase can last for up to 2 years and involves several hundred patients in multi-center trials. So there are several places that are involved. So again, if you're looking at a journal article and it says a phase 2 multi-center trial, that says we're looking at efficacy and we're looking at it over a large number of centers, or a dozen centers or so. Sometimes patients will get a control, and for us, that control might mean the standard contrast agent that's used. If we are looking at something like a pain medication or an allergy medication, then that patient might be given a placebo. Obviously, if a patient is given a placebo in an imaging study, we're going to know right away that there's no effect, so there's no real value to that for us. These studies are often blinded, so the patients and the researchers don't know who's getting which drug. That avoids the Rosenthal and the Hawthorne effects that we talked about before. About a third of experimental drugs pass both phase 1 and phase 2. Then we go on to phase 3, and in phase 3, we're looking more at dose ranging. So these are large scale studies, and we're looking at effectiveness, adverse reactions, so side effects. These are also randomized and blinded. And again, these are oftentimes dose ranging. So some patients will get a smaller dose if it's a contrast agent, some patients will get a larger dose. And the goal is to find the smallest dose that gives an adequate imaging effect in our fields. About 70 to 90% of drugs that enter phase 3 complete this step because it is known that this is safe and it's effective. And at this point, the drug company will ask the FDA for approval to sell the drug or to market the drug. After that, however, we're not done because now that drug can get out into the hands of the public. And at this point, we do late phase 3 or phase 4 studies. So this means now we're looking for different applications. We can better compare these drugs with things that are already being used. We look at long-term effectiveness and cost effectiveness as well. So just a little bit about that for when you see that in real life. A literature review can be either a verb or a noun, and in the context of this course, we're going to use it as both. So for now, your literature review is going to mean the activities that are involved in searching for information on a topic, so you get a comprehensive picture of what is known about that topic. If you start your literature review and you find out, oh, this topic has been extensively studied, it's time to adjust your topic. You don't have to completely change your topic, but at that point you might want to take a different spin on it. It also is a noun in the form that it designates a written report that summarizes a state of knowledge on the research problem. This is placed typically at the beginning of your proposal because it gives some background information and background knowledge for whoever's reading your proposal. I put an example of a proposal online, and I may have put that in the Start Here folder if I was really wise about it. And in that, you'll see that the literature review is pretty brief. I have changed the guidelines of that over the past year. So for last year's class, it's a little bit different. And so rather than just doing 1 or 2 paragraphs, you're going to have 5 or 6 paragraphs because you're going to have a bit of information from each of the sources that you review. The literature review should be done early in a quantitative study so you have underpinning theory to know what is already known, and so you don't waste your time if there is a lot known. What if there is nothing that's known about your topic? Well, then you look for similar studies. For example, when we first started doing contrast studies of the liver, we didn't know what was going to happen on ultrasound, but we knew what happened on CT or MRI. So you can use knowledge from other fields and borrow that knowledge if you need to. So you can look at related topics in your literature review. Those related topics may be from imaging, they may be from nursing, they may be from psychology. It depends on what your particular topic is. The literature review provides an important context for the study because it helps to clarify the research question. It avoids any unintentional duplication if the study has already been performed. Replication is permitted, however, and in real life, not so much in this course. And it acquaints the researcher with relevant theory, and so it may point out some strategies and some procedures and instruments that you might want to use in addressing your research questions. This is from a source I have listed at the bottom that says that the purpose of literature review is to place each work in the context of its contribution to understanding the research problem that's being studied. It may help us to describe the relationship of the works in relationship to one another. It may help us to identify new ways to interpret prior research, and it may show us if there are any gaps in the existing literature. In addition, it may help us resolve any conflicts if there are contradictory previous publications on our topic. It may identify what's already been studied, as we've said. It may point the way to fulfilling a need for additional research. So oftentimes at the end of a paper, the author will say, this needs further study in terms of, and then, there's some ideas there. And it is important that you know how your existing research fits in with what's already known. As I mentioned already, the written literature review, the noun, is placed early in the introductory portion of your research report and for your research proposal. In order to find relevant literature for research, you can consult with your librarian, and this is Megan. Megan is our librarian, that just went away. Megan Richards is our librarian, and she is more than willing to help you. I will post her email along with her name in this week's material, So feel free to contact her, make an appointment to go in and talk with her, or have her help you. She is a very helpful resource. So where are you going to find literature? Well, journals are great sources. Textbooks can be used as well. Dissertations and conference proceedings can be used as well. Conference proceedings often are put out prior to journal articles. There are electronic databases that can be accessed online. Not all resources are universally accessible, and these databases in particular are accessible through your Kent account. The Kent Library allows you to access these databases. A database is going to be somewhere you can search a topic and get a large amount of information. So through the Kent Library page, you can access things like CINAHL, which is a nursing and allied health index that has hundreds and hundreds of potential sources. Medline, PubMed are good ones as well. So there are several. Realize that Google is not a good search for a good search engine for medical literature, okay? Because anybody can put anything on the internet. Google Scholar, on the other hand, is a good search engine. When you look for something on Google Scholar, you can get academic articles, and oftentimes if you're doing this from the comfort of your own home, you're going to get a statement that says, you can rent this article for 1 day for a mere $39.95. Don't do that. You've already paid tuition for this course. Go on the Kent page, and I will put some links to all of these for you, but go on the Kent Library page, search through the Kent Online Journal Center, and find your articles that way. Use Google Scholar to locate the articles, but then access them through the Kent page because you've already paid tuition to be able to do so, okay? I don't want any of you to have to pay. If you can't access it through the Electronic Journal Center, that's where Megan comes in. You can send Megan an email and say, hey, I am looking for this article, and she has the ability sometimes to get those through OhioLink. If you're on campus, please feel free to stop and see her, and she can help you as well. When you are looking for journal articles, okay, you want to begin with a topic or a subject search, and you're going to search phrases. If you want to broaden your search, you can use or. If you want to narrow it, you can use and. For example, I mentioned ultrasound and prenatal ultrasound and ear infections previously. So we could look at prenatal ultrasound or ear infections. Well, imagine what all is going to come up. Every anomaly we can see in prenatal ultrasound and every cause of ear infections and treatments and surgeries for ear infections. That's not going to be very beneficial. If, however, we looked at prenatal ultrasound and ear infections, you can imagine that the number of resources we find is going to be much less. So feel free to use those words to either broaden or limit your search as needed. When you perform a search, you're going to find multiple things from the journal article. You will see the name of the author, the title of the article, the name of the journal, the volume, the issue, and the page numbers. And those are all really important to report and to make sure that you include in your citation, because if someone wants to go back later and look at the article, they need to be able to find it. And it's really important that you give proper attribution to someone who has created a scholarly work. There are also the number of cited references. So year and month of publication is important to us as well. We'll get to that in a minute. There are the number of cited references. And so if you have an article that's been cited multiple times, this probably means it is an important article in your discipline. Those cited references also can guide you to additional works in which you might be interested. The year and month of publication are important to us because unless there is a compelling reason to do so, we're not going to use articles that are extremely old. Okay, and by extremely old, I mean generally less than, they should be within the past 10 years. So 2010 and forward. If this is a topic you're researching that stemmed from a theory that was started in 1978, you need that theory in order to explain your topic fully, then go ahead and use that. But I want a disclaimer on why you're using an article that old. all of us are in fields that have changed and continue to change very rapidly. So we really want to look at things that are a little more current. You may or may not have an abstract. An abstract is a 100-word or less summary of the study. An abstract is not a source. Do not give me an abstract as a source because you don't have a lot of key information, especially related to materials and methods. Okay, so an article may have an abstract at the beginning. Almost always they do. That is not a source. Okay. The textbook that I used to make students buy for this course was by Denise Polite. And there's a quote from her that says, locating all relevant information on a research question is a bit like being a detective. And that is very true. You don't just look at the first 5 things that come up on your search, because you may find valuable information by digging a little bit like a detective would. In order to find research reports, be flexible, think broadly about key terms. So if you're a radiation therapy student, you might search radiation therapy and radiotherapy. If you're a sonography student, you may search ultrasound and sonography both. And you may need to do searches of both your independent and your dependent variable within your hypothesis. Most important information comes from research reports that describe the original research. Those are known as primary sources. So primary sources are articles that are written by the researchers that conducted the research. Secondary sources are descriptions of the studies prepared by someone else. So this is problematic because it can be subject to interpretation. If someone asked you to describe your experience in a class, perhaps in this class, at the end of the semester, you could say, well, this is what this class was like. However, if one of your friends said, oh, well, this is what they told me the class was like, there is potentially some faulty interpretation. So look for primary works rather than secondary works. So it's best to use primary sources. Review articles are secondary sources. They're a good place to begin because you can look at the references at the end, but they're not the optimal resource to use when we're looking for original information. During a literature search, we can find empirical references that have studies that have been performed that tell us sensitivity, specificity, as well as the number of individuals who were studied. Okay, empirical means numbers. We can find conceptual resources, and especially for this course, sometimes those are important. Where did the underlying theory that we use right now come from? There are also articles that give opinions or beliefs or points of view, and there's a star next to that, as there is to the next one. And sometimes we have case studies, or as a single case, or there's a clinical impression. Those are subjective, so they can give you an understanding of the topic or the research problem, but they're not relied upon to summarize a body of knowledge because they are, again, a personal opinion. This is from an article written by my friend Dr. Kevin Evans, who is at Ohio State. And this shows the strength of evidence in a research report. So if we look at the bottom, anecdotal, okay, oh, I had this one experience with a patient where this side effect happened, okay. An expert opinion, well, this physician is an expert in this topic, and so this physician has seen 3 side effects. Case reports would be taking those cases and writing them up. Surveys are a little bit stronger. Case-controlled studies are stronger yet. Cohort studies are stronger yet, but the strongest evidence comes from randomized controlled trials where patients are carefully monitored and we have the aspects of manipulation, control, and randomization, as we'll talk about next week. A meta-analysis is, or a Cochrane review, means that several randomized controlled trials are evaluated. So that is the strongest evidence. So we're really looking for things at the top of this pyramid rather than at the bottom of this pyramid when we're looking for strength of evidence. In order to critically evaluate a work, we need to look for a couple of factors. We need to look at the provenance, and the provenance means where are the origins of this research? So what are the author's credentials? Are there arguments supported by evidence? What methodology was used? What's the research design? That's coming next week. Was the sample size appropriate? Were the data analyses performed appropriately? Is the report objective? And one of the things we look at with that is the potential for biases in the form of conflicts of interest. Who funded the research? If this is a drug study and it was funded by, the paper was funded by the drug company, it's a little suspect. Is the author persuasive? Is there value in the paper and in the arguments? And does it contribute to the understanding of the subject? And does it contribute to our fields? Who is the intended audience? Please, 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 please do not use anything that is intended for patients or for lay people, and that is Google. Okay. So if in the article it says, you will be having an MRI, you will be placed on a table, and you will be given headphones or earplugs, that's what a patient needs to know. That's not what we need to know in our fields. And bias, as I mentioned. So this is a table that talks about research quality, and I just want to give you this because I think this is interesting. So research quality is deemed to be of quality if it has 4 C words. Is the research credible? Okay, meaning was it performed in a way that is methodologically sound? Is it contributory? Does it matter to our fields? Is it communicable, meaning understandable? And then is it conforming with ethical regulations? Okay, so here are the factors that go into that. So credible and contributory are seen here. You can read these on your own. Okay, and communicable and conforming are seen here. When you look at a website, okay, there is information that's very valuable on the website of a lot of our national societies. And I have been asked to do some webcasts for the International Contrast Ultrasound Society, and that has a lot of good ultrasound contrast articles that are credible as well. But look at the domain of the website. Is it maintained by Dr. Google Quack, or is it maintained by a professional organization, the American Cancer Society, the Society of Nuclear Medicine, a national society? Your references for this class can be put in one of 3 manners, either APA, MLA, or AMA, but pick one and use it. Okay, I have the APA and MLA links in Blackboard. I will put the AMA link as well. And like I've said before, we use AMA and the things we publish just because it's the requirement of most medical journals. If you have had prior experience with one of the other 2 and you are comfortable with those, you may use that as well. Citation needs to include the author's names, the title of the article, the journal, the volume in the issue, the page numbers, the date of the publication, and the digital object identifier if it is a journal article is published online, which pretty much all of them are. I will ask you to submit PDFs of all of your journal articles. Okay, you do not have to print them and give them to me. You can email them to me, but please know that I will check each of your references. So please be sure you're diligent in performing your literature review. You will have a first article assignment due, and I will give you more information on that on Blackboard. But that will be a way for me to check and make sure that everyone is on the right path for their literature review. Have a good week.